The Aged Care Royal Commission has heard a lack of staff expertise in nursing homes has led to shocking injuries to elderly people being left untreated. The inquiry was also told dementia patients are regularly over-medicated to manage their behaviour and sometimes die earlier as a result.
Medication is supposed to be used to treat illness, but the Royal Commission heard it's increasingly used as a technique to manage nursing home residents with complex needs. The Commission heard 80% of dementia patients in care facilities are on some form of psychotropic drug, including antipsychotics, antidepressants and sedatives.
They are a last resort, but too often we see them used as a first resort, and the use of medication should never be a substitute for good quality care.
Professor Strivens told the Commission that as little as 10% of dementia patients who are being given that medication would actually benefit from it. He said the side effects often outweighed the benefits and could lead to death.
We would see an excess of 10 extra deaths in those 1,000 people and 16 strokes.
The Commission heard the complexity of patient needs is increasing, but there are fewer registered nurses, leaving staff overworked and in some instances underqualified.
Many of them across the country describe their workloads now as unsafe, they're untenable. They report to us that that's why they're leaving the sector.
The unregulated worker with a very short certificate training is not prepared and does not have the level of assessment and planning skills required to meet the needs of the current aged care clients.
The Commission heard the lack of appropriately skilled workers can have horrific consequences. In one gruesome example relayed to the Commission, an elderly man's genitals became painfully deformed while connected to a catheter. While staff gave him painkillers every night, they didn't examine the source of his pain or refer him to a GP until too late. The Commission will continue hearing evidence in Adelaide next week. Candice Prosser, ABC News, Adelaide.